Pramiracetam was the original racetam, a compound developed in the 60s by Park Davis, which is now Pfizer. It's one of the racetams that you don't hear much of these days, but it's still sometimes prescribed by doctors for the treatment of cognitive symptoms of some medical conditions. It's also still used in research, and some people take it for memory enhancement. Pramiracetam is fat-soluble, so it can be taken by mouth, and it's absorbed directly into the bloodstream through the intestinal wall. It also crosses the blood-brain barrier, so once it's in the brain, it binds to receptors on neurons, and these influence their ability to respond to stimulation. There's several different types of nootropic receptors, but Pramiracetam seems to bind preferentially with the sigma receptors. As a nootropic, Pramiracetam is used to treat cognitive impairment or decline caused by aging or trauma. It can also be used to prevent or to delay the onset of cognitive impairment caused by brain damage from lack of oxygen before birth. The Pramiracetam appears to promote the growth of new branches or dendrites within the neurons that tend to link neurotransmitters together at the axon terminal. These networks are called synapses, and they're where signals are exchanged between the neurons. Synaptic plasticity is believed to play a role in memory formation, so it's thought that Pramiracetam can help to increase the mental performance in this area of cognition. According to some animal studies, Pramiracetam's effect on the brain seems to be permanent. One study has demonstrated a return of cognitive function after discontinuation. This might be due to extensive binding in the brain beyond receptors that are related to cognition. While it's unlikely any side effects will lead to serious consequences, some possible issues that can come up are mild anxiety and sleep problems. Some people experience the mild anxiety and insomnia when they're taking Pramiracetam. It seems to activate the HPA axis in humans, and this is associated with stress, hormone release, and sleep regulation. Some people also report feeling like they're loopy when they're taking Pramiracetam. They may feel like they're losing it or they're not there. While this may or not be a true effect, it's still worth keeping in mind. Depending on the legality of Pramiracetam in your country, it might be labelled as a supplement, a medication, or as not for human consumption for research purposes only. The dosage also can depend on many factors, such as your age, sex, metabolism, interactions with medications that you're taking, individual tolerance, and more. So you should always only take Pramiracetam under the advice of a doctor. Most studies have used doses between 1.2 and 3.6 milligrams per kg, but the exact dose depends on the study and how long it lasts. Studies that have found no effects use the lower doses. From the studies on Pramiracetam, there was massive difference in the doses. One study used 1.2 milligrams per kg of body weight for 2 weeks on healthy elderly adults, whereas another study used 1,280 milligrams per day for 14 days in a study on elderly medical patients with a variety of cognitive issues. 3.6 milligrams per kg in a single-dose study in healthy volunteers, and 7 to 12 milligrams per kg body weight for 1 month in a study in elderly adults. A guideline for doses in medical practice is about 3 months, but this isn't always feasible. How long to take it also depends on how you can tolerate it. Some people find they become tolerant very quickly and they need to take higher doses over time, whereas others find a lower dose is effective for them and they don't need to increase it. Pramiracetam can also cause side effects like headaches, fatigue, and insomnia. However, like most of the racetams, side effects diminish when you also take a choline source to supply your brain with the extra acetylcholine that it needs. Pramiracetam is a racetam nootropic that's used for cognitive enhancement. It's been shown to be effective for conditions like ADHD, stuttering, and anxiety. It might also improve memory in some people. Some people can also experience no effects from Pramiracetam, while others notice a difference with intermittent use or after continuous daily use for several weeks. The science is still out on how effective it is for cognitive enhancement. It might be more effective for certain people than others. As always, consult a doctor before changing your diet, supplementation, or medication. To learn more about nootropics, herbs, supplements and natural treatments, or to book a consultation, check out my website.